Okay, so I'm doing a venipuncture today on my beautifully drawn hand here. I'm going to first verify the provider orders and gather my supplies such as my necessary needles, alcohol pads, gloves, dressings, and my lure lock system that has already been prepared in a sterile environment. I'm going to go in the room and provide patient privacy by closing the curtain. I'm going to perform hand hygiene after I have closed the curtain. And now I'm going to put on clean gloves. Somehow. Some way. Okay, while I do that, I'm going to introduce myself to the patient and their family. And I'm going to identify the patient with two identifiers, compare those to the MAR and medical records with their ID bracelet, and ask the patient to state his or her name. I'm going to explain the procedure to the patient and ensure that they agree to the treatment. I have already prepared the IV solution, and I'm going to now prepare the solution site. So first I'm going to place a tourniquet normally it'd be about 10 to 15 centimeters above the insertion site. Today it's going to be where it fits. There we go. And then I'm going to check for a distal pulse. All right, now I'm going to get into my alcohol swab, and I'm going to first swab in the horizontal direction, the vertical direction, and then in a circular direction. I'm now going to make sure I let the site dry and do not insert anything until the site is dry to avoid burning the patient. I'm now going to grab my catheter. I'm going to anchor the vein, placing my thumb over the vein and stretching out the skin in the direction of the insertion site, 4 to 5 centimeters distal to the site, and ask the patient to relax and tell them they're going to feel a stick. I'm going to insert bevel side up at a 10 to 30 degree angle, slightly distal to the actual site of puncture in direction of the vein. I have observed for blood return in the flashback chamber. I've lowered the catheter to flush with the skin, and I advanced about 0.6 centimeters into the vein, loosen the stylet, and hold the skin taut while stabilizing, advancing the catheter. I did not insert the stylet once it was loosened. I'm stabilizing the catheter, releasing the tourniquet, and applying firm pressure to the vein 1 inch above the insertion site with one finger while keeping the catheter stable with my thumb. I'm going to quickly grab my lure lock system and attach it to the end of my catheter, being sure not to touch the point of entry to maintain sterility and secure the connection. And I'm going to flush the system slowly with the remaining saline from my pre-filled syringe. Slowly. And then I'm watching for swelling in the area. While I'm still securing the catheter, I'm going to remove the saline lock and apply a dressing. All right. Now I'm going to help the patient into a comfortable position, place toiletries and personal items within their reach, place call light within their reach, ensure the patient knows how to use their call light, raise their side rails ×2, and lower their bed to the lowest position, dispose of all of my supplies, and remove my gloves and dispose of them. I also am going to perform hand hygiene in the room, and then I'm going to document and report the patient's response and any expected or unexpected outcomes.